This is an example of an x-ray room, and most x-ray rooms include a table unit and a wall unit, and then the x-ray tube itself. We can move everything around in order to obtain the images. My name is Kristen Thornton. I am the Diagnostic Imaging Supervisor at University of Louisville Hospital. My job is to lead our team of x-ray techs in the department at University of Louisville Hospital. I also handle the goings-in of the facility as far as research studies and also direct patient care and contact. I have been an employee here at University Hospital for 15 years. I started here in 2006 as an office clerk in the radiology department. That was kind of my foot in the door to healthcare, so to speak. And at that point, I was in the radiology program, knowing I wanted to be in this field, but I hadn't completed my education yet. And so from there, I moved into an x-ray position after graduation. I worked my way as a lead technologist and then supervisor. My favorite part about being a floor technologist was working in the ER. You see the worst of the worst in our ER, being a trauma facility. I loved when we had these patients come in that were terrified, thinking, you know, I just got x-rays at another facility and it was a terrible experience. And being able to reassure them and do our job the way that we do it here and not cause them pain was very rewarding for me, because as a trauma facility, you have to think outside the box. And here we know how to obtain the same imaging in different ways without manipulating the patient. So in order to get images in different ways, we use things around us, whether it's angling our machine, moving our equipment in different ways instead of the patient. We use teamwork on a daily basis, whether that is with our own coworkers here in imaging or with physicians. For an example, in fluoroscopy, we work hand in hand with our radiologist. We do procedures. Sometimes they can be procedures such as a lumbar puncture, where we're inserting a needle into the spinal canal to pull off fluid. Sometimes the procedures are more minor, but still very helpful to see what's going on inside, where a patient would ingest a contrast agent to highlight inside of their body so that we could see those pathways. So we work very closely with the physicians in the room doing that type of care. We also work hand in hand with physicians in the operating room as we're running the equipment with their direction so that they can place whatever hardware they're doing to fix the patient's injury. In order to become an x-ray technologist, there are several schools in this area, such as Sullivan and JCTC. They are 2-year programs. Sullivan will be a 2-year program. JCTC is a 2-year program once you do all of your prerequisites. So it can take 4 years. What makes working here a great thing, you do get to think outside the box, and it's rewarding.